everyone, welcome to my presentation on varicose veins. Let's dive in and take a closer look. So what are varicose veins? Varicose veins will typically appear on the legs and appear as swollen or bulging veins. They can be dark blue, purple, and sometimes red. Varicose veins can appear on other areas of the body, with the most common being hemorrhoids. How does a varicose vein develop? The valves inside our veins that prevent backflow are weakened or damaged. This causes blood to flow backwards and pool in the vein. This will cause the walls of the vein to stretch and become weakened. This video gives us a more in-depth view of blood flow in a normal healthy vein versus in a varicose vein. Notice how in the varicose vein, the valves stop working properly, which allows blood to flow backwards, and it will start pooling in those areas. The vein walls become weakened and enlarge where the blood is pooling. This leads to the vein twisting and bulging, which can then be seen on the surface of the skin. Varicose veins are common and usually do not pose any serious medical issues. Some common risk factors of developing varicose veins are family history, pregnancy, sitting or standing for prolonged periods of time, obesity, and age. Common symptoms of varicose veins include bulging veins with a dark blue or purple coloring that can be seen on the skin surface, cramps, swelling, especially in the ankles, itching around the vein, pain in the legs, especially behind the knees, and a heavy lethargic feeling in the legs. What can we do to minimize our risk of developing varicose veins? At the end of a long day, we can elevate our legs above our heart when possible. We can maintain a healthy body weight, engage in regular physical activity. We can wear compression stockings, which may not be the most fashionable, but they do work really well. And we can avoid extended periods of sitting or standing. If there are long periods of sitting or standing, we should make sure to move our legs and flex our ankles to improve the circulation. Although varicose veins do not usually pose a serious medical threat, they can be painful, contribute to blood clots that can lead to deep vein thrombosis, and they can also contribute to poor blood circulation. There are treatments available which are all minimally invasive. Both sclerotherapy and laser therapy are non-surgical and can be done in a physician's office. With sclerotherapy, a solution is injected into the small to medium-sized veins. This causes the vein walls to stick together, which will block off blood supply. The vein will eventually turn to scar tissue and will fade. Laser therapy, which can be used on small, medium, and large veins, requires that a small catheter be inserted into the vein, which then emits heat into the vein. This will shrink the vein wall and seal it closed. Blood flow is then redirected to healthy veins. With surgery, the physician will tie off the affected vein, and in some cases, the vein will be removed. The patient will be under general anesthesia and sometimes a spinal anesthesia. This does not require hospitalization as it is an outpatient procedure, but the downtime for surgery is much longer than both sclerotherapy and laser therapy. Downtime for vein surgery is going to be 1 to 2 weeks. And here are my sources. Thank you.